Thank you so much for inviting me. And this is an issue that's near and dear to my heart. I should say at the outset that the views that I express are my own and don't necessarily reflect that of the Tennessee Attorney General. I would like to go and provide a summary of the litigation against HRC Medical Centers, which is currently on appeal in the Tennessee Court of Appeals, and also provide a high-level summary of the adverse events that some of those patients experience, and then sort of comment more on recent safety concerns concerning compounded bioidentical hormone replacement therapy. And I should say that the litigation that I was involved in was a state Consumer Protection Act case. It was not a disciplinary action. It was not a medical malpractice action. It was not a personal injury action.
Can you pull your microphone
yes.
just a little bit closer?
Absolutely.
Thank you so much.
Is that better?
We really want to hear you.
Okay. So the litigation that I was involved in was not a medical malpractice action. It was not a personal injury action. It wasn't a professional disciplinary action. It was under our state Consumer Protection Act, which broadly prohibits false, deceptive, or unsubstantiated advertising claims. And that was the basis for our suit against HRC Medical Centers. As part of that lawsuit, we retained 3 experts. The first was Dr. Ted Anderson, who is the chair of the Division of Gynecology at Vanderbilt University Medical Center. And I think as of 2 days ago, he's the president of ACOG, though he didn't serve in that capacity as an expert. We also retained Dr. James Liu, who's chair of the Department of Obstetrics and Gynecology at University Hospitals in Cleveland and serves as a professor at Case Western Reserve School of Medicine. And for the testosterone piece, we retained Dr. Joel Finkelstein, who's a renowned endocrinologist from MGH and Harvard Medical School. The clinic itself, HRC, had 3 locations in Tennessee. It had 8,000 patients who purchased compounded BHRT. Through an affiliate networks with other clinics in other states, they claim to provide compounded BHRT to 33,000 other people. In terms of the BHRT that HRC provided, they provided it to women and men. And for women, the BHRT that they provided was a hormone cocktail that had an estrogen, progesterone, and testosterone component. For the estrogen component, it was a subcutaneous pellet that was implanted around the hip, made of 17-beta estradiol. And usually the dose ranged between 3 milligrams to 18 milligrams. For progesterone, it was micronized progesterone, and it was a sublingual tablet that was placed under the tongue and dissolved, and usually the dose for that was 100 to 200 milligrams. For testosterone, it was also a subcutaneous pellet that was implanted at the hip, and that the dose for that was up to 200 milligrams for women. For men, it was just testosterone, and it was just the subcutaneous pellet of testosterone, and that could be up to, at its highest point, 3,200 milligrams in one administration. In terms of the protocol, HRC treated blood serum levels of testosterone as a pathological condition, and so they targeted ranges in women between 250 and 300 nanograms per deciliter, which according to most labs is in the male range. Oftentimes they would go higher than that and achieve ranges of testosterone in the 400 range, 450. That was not uncommon to see levels of testosterone in women at 400 nanograms per deciliter or around that range. To put that in context, our experts told us that the levels of testosterone are consistent and would be suggestive of an androgenic tumor or a patient who is undergoing female-to-male transgender surgery or a hormone regimen for that. For men, the blood serum levels for testosterone, they sought a range of 1,100 to 700 or 1,100 to 1,400 nanograms per deciliter, but often achieved testosterone levels that were significantly higher than that. And this was part of a marketing effort that was on TV in the morning, TV at midday, radio, social media. This was not marketed to menopausal women for short-term use to relieve vasomotor symptoms. This was marketed for women from 18 to 92 for basically an anti-aging cure or sort of a fountain of youth. That was sort of the general message that they sought to convey. The advertising claims that they made, they harped on the all-natural component. The pellets were made from wild yams or soy. They marketed them as all-natural. They used categorical claims for safety. They said that these pellets and the treatment was absolutely or completely safe. They said that it had no cancer risk. They said that it had no side effects. Elsewhere, they would disclose minor side effects such as peach fuzz above the lip or 1 or 2 pimples, but no other side effects besides that. They also made marketing claims, superiority claims as to the superiority of BHRT over traditional hormone treatment therapy regimens like the conjugated equine estrogen, Premarin or Prempro. In addition, they had a slew of marketing claims that were preventative or treatment or cure claims regarding Alzheimer's disease, ADHD, there's heart disease, pretty much every major disease. There was some representation that there was a treatment, prevention, or cure. Let me go through. In terms of the adverse events, we first became notified of it. Our state has a general business complaint clearinghouse. So for anything, I think it used to be contractors or it might have been the cable bill, just any sort of commercial complaint. And consumers began to complain to that agency, sometimes in graphic detail about the side effects that they had achieved or had experienced. So as part of our lawsuit, we collected affidavits from 49 different women and 5 men. Not all of those experienced adverse events, but there were women who submitted affidavits saying that they experienced and reported side effects that were consistent with virilization. There were women who experienced voice changes. Their voice deepened. There's one woman who could no longer sing in her church choir because she was a soprano and her voice became so deep that she could no longer fill that role. There were several affidavits from women who experienced significant hair loss. There was one woman who would routinely go swimming in her outside pool, and she would clean the filter regularly, and after she began taking the therapy, she collected her own hair about the size of a dinner plate. There were other women who experienced clitoral hypertrophy. One woman submitted an affidavit saying that her clitoris swelled to the level of a small penis after taking this therapy. The compounding pharmacy that supplied the clinic at issue, there were internal documents at HRC indicating that there were quality control issues, and the quality control issues were alleged in the HRC's documents that the pellets themselves were too tightly bound and that it made the absorption rate unpredictable. And so in one case, the pellets themselves are difficult to extract once inserted. And so a supplemental pellet was inserted, and that could potentially lead to a super spike of testosterone. So those are some of the issues that we have seen in our case against HRC Medical Centers. I certainly don't want to paint all bioidentical hormone replacement therapy providers with a broad brush. I know there are certainly responsible ones who advertise responsibly. There are other actions by other states. California recently, their state medical board took action against a provider who was administering hormone replacement therapy to a woman with an aggressive uterine cancer. In Kentucky, there was disciplinary action by the medical board against a woman who was providing thyroid or testosterone therapy as well. And I should say, going back, to the adverse events from HRC patients, there were individuals who experienced endometrial hyperplasia after taking the therapy. The company had forms that were already filled out for therapeutic phlebotomies because of the increase in the red blood cell count. And those are some of the things that we saw in our state case. I'd be happy to answer any questions after the panel's done. Thank you so much.
All right. Thanks very much.